Welcome to another Crawford Cogitation. The question today is, will we be paying less for gas because of COVID-19? Let's get started. Let's start with a simple question for you. Which is more dangerous, flying a plane or driving a car? If you're like most people, people will perceive flying as a more dangerous activity, but in all actuality, driving a car is much more dangerous. The question now is it dangerous to be a pedestrian? And as we always know, the question is, it depends. If I lived in Los Angeles or New York, I would be much more likely to die from a pedestrian or from a car accident as a pedestrian than I would be in other cities. So what is this idea of risk assessment? Well, risk is anything that may be harmful to you. And a stressor would be anything that would add to that risk factor. When we look at the categories of human health risk, we talk about the idea of something that could be physical, biological, or chemical. A physical activity would be a job. It would be you rock climbing, it would be skydiving, it would be any hazard that you put yourself into as a risk. And that's kind of why male death rates tend to be higher and women tend to be longer lived, because they have less risky jobs in most cases. But when we look over to the biological and chemical side, it tends to be a little bit different. This is when we talk about the idea of carcinogens, allergens, teratogens, neurotoxins, endocrine disruptors. And this tends to have effects on people in different ways. So when we look at risk assessment, we're looking at a couple different factors. There's a variability that exists, and then there are factors in which play into those variabilities. We look at the idea of uncertainty from the standpoint of toxicology studies. When we're looking at things, we don't necessarily always know how it's going to affect certain age groups or certain minority groups. But we take the variability and the uncertainty and try to make the best probabilistic modeling to tell us how we are going to react to the situation. And as we all know, models are inherently flawed, and the reason they're inherently flawed is because they're not the real thing. The input data is discretionary upon the person who created it, and the impact may just not be known completely and totally as we look at it. So risk assessment is just that. It's a risk assessment, trying to figure out what the potential risks are for us and how it may affect us in our lives. Go ahead and take a moment, write in your literacy journal any thoughts that you have right now. As we get looking at some data, we want to keep in mind the different populations of countries. And this is an example of where the population areas are. Obviously, China and India are highest population. The US comes in there as well. What we also want to do is keep in mind what happens with the surface area. So how big are the countries that we're talking about? Russia clearly being the largest, Canada, and then the United States. And then you can look as the top 20 are listed here on the screen for you. Once we take in the idea of surface area, we also have to think about population density. This map shows us where the population density are the highest, and this coincides with what we know from our population studies. Notice how India is highly populated. So the question is, what is a pandemic versus an epidemic? An epidemic is a localized problem. So in Ohio right now, we have an opioid epidemic. It's plaguing our state financially, whereas the COVID-19 right now is a pandemic because it's worldwide. Pandemics are not atypical. We've had these for a long time throughout history. The Black Death, known as the bubonic plague, was in 1347. And that's the first one that we keep in mind, and it's most devastating. This changed a lot of things from a social standpoint and how cities operated. You can see smallpox, Spanish flu, and the plague of Justinian all come in on the top 4 list of most deadly pandemics. But there have been others, as listed here. If you look at the COVID-19 in the middle or at the bottom, it actually is projected. So this is ongoing pieces. Is this swine flu in 2009? You can also look at the MERS and the SARS values that exist there. Notice in the top left is the HIV/AIDS pandemic. This is going to be interesting to see how COVID-19 actually plays out, to see where it actually falls in the ranks of pandemics. So the question is how well are we prepared to deal with a pandemic? And this Global Health Security Index score shows that the U.S. is at the top, and it looks at indicators such as epidemiology, workforce, biosecurity, and emergency preparedness and response planning. The U.S. tends to be much better off than most countries when it comes to the infrastructure necessary to deal with it. And if you've been paying attention to the news at all, you can see that some people have questioned that, but the U.S. is actually usually in a good place. When a pandemic happens, there are occupational risks. On the left-hand side there, you can see the non-healthcare related officers. The blue is representing there, and the green is actually healthcare officers. If you look at registered nurses, they're high, huge population there. Dentists are high. But if you look at the left-hand side, you see computer network architects, lawyers, and pieces like that. So really what it comes down to is the people who are interacting with you more have a much higher likelihood of contracting the virus than those who work behind a desk. This is also interesting because it starts looking at the people by socioeconomics, or the people who are able to work from home are looking at the income with the top 25%. So most people who have money can stay home and work, whereas the bottom 25%, there's only very few of them that can actually work from home. These end up being service industry employees and people who are working for hourly wages who don't have the ability to pull a salary while in this pandemic. The other piece that you have to look at is the recommendations that come from the Center for Disease Control. This is talking about the idea of face coverings, cleaning regularly, and social distancing. And here in the state of Ohio, we've been asked to stay inside and limit our trips. And the reason being is actually pretty straightforward mathematically. If you look at social exposure reduction, if one person reduces it up to 75%, the idea is that after 5 days, very few people are infected, and only after 30 days would you have 2.5 people infected. The reason why this is significant is that it was never to stop the pandemic. It was actually to prolong the onset of it, so we could actually be prepared from a medical standpoint. Reducing social exposure by 50%, 5 days, 1.25 people affected, 15 affected after day 30. But if we went about business as usual, the understanding from the models would be after day 5, we would have 2.5 people infected, and then by day 30, 406 people infected. And the belief was that it would overrun our hospitals, so we wouldn't be able to care for the people that we needed to. Go ahead and take a moment and write your thoughts here. So let's look at what's happened since we've had these stay-at-home orders. Media consumption is always interesting to me because if we look at boomers, 57 to 64-year-old people, they've done more and more broadcast TV, and basically they haven't changed their consumption very much. They just tend to watch more of the regular TV. If you look at Generation X, those are the people who are 38 to 56. You can see they're looking at more online stuff. They're watching broadcast TV, but they're doing TV and streaming, some online videos, spending some time with books, but getting their news as well from online press. Millennials, on the other hand, online videos, streaming are significant, listening to music, consuming information from online press, where you look at Generation Z, where most of you are, you've probably been doing a lot more online videos. I think Netflix and Hulu and Disney Plus have probably made a mint off of the streaming processes that they have. Take a moment to write down your ideas here. Before we go any further, I want to make sure that we put things in perspective. This is from the Center of Disease Control, and it talks about the deaths, hospitalizations, and illnesses from the influenza burden in the United States. If you look at last year's death toll from influenza, you were looking at 61,000 people. And that was much higher. And if you recall those times in the 2018 time frame, we were looking at a strand that actually morphed more than what we were expected, and it did not fall into the vaccine that we had been distributing. So when we look at this pandemic, and this data comes from Our World in Data, which we've seen before, confirmed COVID-19 deaths, and these are a couple sample countries just to keep an eye on what's going on, things that we know. Part of this is going to be a recording, how each of those countries are noting the deaths, and sometimes it's good and sometimes it's bad. So obviously it looks like the United States has a huge amount of deaths that are going on. The question is how rapid they are. You can see on this graph, it says doubling every day, doubling every 2 days, every 3 days. Right now, we're in the range close to every 5 days. This conversation of bending the curve is actually looking at what's happening to the total population, and are we reducing the amounts? Some people will call this herd immunization, but you can see where China is right now. China is where the outbreak started, and what we're looking at is a huge decline in what's happening there. It appears that most countries are actually moving downward at this point in time. This actually starts putting it into perspective because it takes the population density into account, looking at deaths per million of people. And you can see the curves tend to be going down. Brazil right now, slightly increasing, and they're a little bit behind where the other countries highlighted are. The 7-day, you start looking at the rolling averages, and this one is the 7-day rolling average to see where the decline is. What you're looking at is trends. So if there's a blurb that goes up, that could be from data entry, that could be from a resurgence of things. But as we go to open up our communities a little bit more, the question is, will the number go back up? This looks at it closer with a 3-day rolling average, and you can see the trends are definitely going down. It appears that we have passed what would be considered the peak for the United States. Again, the U.S. is showing a higher level of confirmed COVID-19 deaths, even though testing is less than what we would like. It still shows that we are able to record that information and get it out. And I think the U.S. is a very transparent country when it comes to those data sets, and our medical professionals do a great job of helping track that. I'm not so sure that we can say that about other countries because they don't have the infrastructure that we do here in the U.S. This is the testing piece. The whole big question about how we are going to continue on is, are we able to test and being able to understand where we're going? And that's probably the biggest concern from most of the medical professionals who are talking about this, is being able to test and identify who has COVID and who does not. At the very beginning of this, talking about in January, many people were getting sick and they were being told it's an upper respiratory problem because there was no test available to say, hey, is this COVID-19? So those people, and you guys may know several of them who have been around, the likelihood that they were exposed to COVID-19 is probably pretty good because they didn't have the flu and it was just diagnosed as an upper respiratory problem. So if you start looking at tests per 1,000 people, this is talking about just specific pieces of the United States. It doesn't go into the specialty labs or the local labs that are doing it. These tend to be the government-run labs or the hospital-run labs. Again, we look at the economic factors that are playing here. If you look at it by GDP, you can see that the countries in Africa tend to have less capabilities, which isn't a surprise to us because of their infrastructure. Whereas the more developed countries have much more testing capabilities. So are the cases increasing? We're going to see this here in the US and in Ohio, that the cases are going to be increasing just because our testing confirmation is there. So as we continue to test, we're going to see numbers, and it wouldn't be a surprise if we saw a spike in the United States. And that may be a factor of resocialization, or it might be the fact that we can just test more. So here in the US, again, daily confirmed cases are going down, which is a good sign for us, meaning that the peak has probably already happened. And the death toll is lowering itself. If you look at the United States and start putting it as case fatality rates, this is without everybody being tested who might possibly have it. The United States is still below the world average on fatality rates, and that's a credit to our medical professionals. Keep in mind, though, that there are many people who have symptoms of it that aren't in the elderly age group, and so they're not being tested, so they aren't even included in this. So as we continue through this process over the next couple of months, you're going to see that this fatality rate will probably go down because of the testing capabilities and the fact that more people will survive from what's going on. Take a moment and jot down some ideas. So as we look at the economic factors of this pandemic, one of the big things is the airline capacity by region. When we all had to change our spring break plans for the fact that the stay-at-home orders were in place, you started seeing effect by the airlines. And this is a significant factor because they're a huge part of obviously the travel industry, but the entertainment industry too, because with less people traveling places, the entertainment sector is going to reduce their economic stability. There are places that are being successful. E-commerce rates have gone up. If you look at bread machines, I think this is a great one. Many of us have probably been doing some cooking at home a little bit more than usual. So bread machines are up 652%. But if you look at golf clubs, for instance, are down, coolers are down, luggage is down. There's all kinds of different things. This is a really interesting part of seeing who is buying what and how much of it. Never mind the toilet paper shortage of 2020. So how does this really affect crude oil prices? The fact of the matter is that we are at a point where less people are traveling. So therefore, there's more fuel supply that is on the market. We base our prices here on the West Texas Intermediate crude oil prices, and that comes from Texas. The big concern about this is how far the price will go down. If there's no demand for it, but the production is still at the same place, we have a storage problem. If you look at, in 2009, 100 million barrels were in sea tankers offshore. And at this point, in April 2020, 160 million barrels are. So you're talking about a cost to store this has gone up an incredible amount. If you look at the graphic there in the middle, in February it was $20,000 per day to store it on a tanker. Now you're looking at $200,000 to $300,000 in March, and that number has just continued to go up. We here in the United States are in a good place for storage of our oil reserves. Other countries aren't so fortunate. President Trump has actually ordered the national strategic oil reserves to be replenished. So we're actually getting this at a very low price to actually increase our stockpile. But there are countries that are not in the same place. Saudi Arabia recently drove the price of oil down, but most countries who are oil producers need to have the cost of oil to be at least $40 a barrel in order to make a profit. This will be an interesting factor as we go through the next year to see how these countries recover from it. But my guess is that it's going to be a very difficult pathway for them. What about jobless claims and the economic factor that happens here in the U.S.? Obviously, jobless claims have gone up. The good news about the economy was actually doing fairly well before this happened, and there was no financial piece that was doing it or stabilization piece that was doing it. The economy has taken a downturn due to everybody being at home. And all indicators are saying when we come out of this that we should be able to go back to the pre-pandemic we should be able to go back to the pre-pandemic actions we should be able to go back to the economic success that we were having before the pandemic. Another interesting factor as we go through the next several months, as scientists are able to look at data, this is actually just looking at NO2 in the air in selected cities. Clearly, the amount of transportation that's going on is being reduced, and we're seeing a reduction in NO2. So it'll be interesting to see what we find out from an environmental factor in the coming year. Go ahead and take a moment and write down any statements you have. Any questions that might be on your mind. So the question, will we pay less for gas because of COVID-19? As of right now, gas prices are down. We're probably paying half of what we did last summer. So in the short term, yes. What is it going to do to OPEC and the world trade? It'll be interesting to say. What do you think the implications are of what we've talked about?